of Network, Lobby for Catholic Social Justice, and I have the honor of being leader of Nuns on the Bus. As you know, this year we're doing the bus virtually because of the pandemic. We're unable to really, get out on the road. But what we have for this afternoon is a joy because we're returning to Rochester, New York, where we got to be at St. Joseph's Center 4 years ago. And so we're going to stop by, meet with some of the staff, hear their stories, hear how things have changed, and how the concerns of this COVID reality are affecting them in the Rochester community and the impact. We know they've been in the news, and so I know they're engaged in some of the racial justice work. So I'm eager to hear how healthcare and racial justice all work together. So let's invite in our friends. Let's get started. Hey, here you come. All right. Welcome to the kitchen table where we get to sit around and actually have a conversation. As I said, I'm really excited to be here. So maybe you could each introduce yourselves and what your role is so that our viewers get to know what your role is. And then we'll just get started with the conversation. So Robin, do you want to start? Since in my box, you're closest to me.
Sure. Hello, Sister Simone and everyone else out there viewing. My name is Robin Carter. I'm the Director of Healthcare Access and Outreach here at St. Joe's Neighborhood Center. Here in Healthcare Access, we're usually the first stop for our clients who are interested in becoming patients. We also provide various other services to the community, such as food referrals, clothing referrals, bike referrals. We assist with SNAP applications, which is our food stamp, HEAP applications, which assists with heating needs in the winter, and any other needs usually that the community may be interested in.
Wow, that's fantastic. That sounds like quite a job. I'm assuming you have some help to do that, right?
Yes, I do. I have a department colleague, coordinator, Emily, and we also rely on quite a few of our volunteers. And I do have some college students, interns that I'm working with from our area colleges.
Oh, fantastic. Thanks, Robin. Phyllis, what's your role at this amazing place?
You know what? I am there, Phyllis Jackson. I'm a registered nurse. I'm the Community Project Wellness Manager at Common Ground Health, which is a community-based organization. And I am probably, to say, their biggest fan. I mean, this organization is just phenomenal in the work that I do in the community, because I'm a foot on the ground person. And I also have an organization called Interdenominational Health Ministry Coalition, in which we work with faith communities to establish functional health ministries within their congregations to educate and screen and teach and help them to be healthy. And of course, our number one resource that we're giving out is St. Joseph's Neighborhood Association. So to have St. Joe's available, that we could share that with the community, knowing all of the good work they do, being able to support them and just see them grow in what they do. They are absolutely, they sit at so many of the tables. We're called Common Ground because we have a table where people are invited, because the issues that we face within Rochester and the surrounding areas are too big for one organization to handle, one organization to do anything about. But we convene these tables where people can come together and work on solutions. And St. Joe's is at the table in every area, whether it's health, social justice, and equity, all of those things. So I am here to just say they're reaching us. They are essential to the work that we do in the community, and we're just so supportive of them, and glad to have you here hearing so that the world can know what's happening at this bus stop here in Rochester, St. Joe's Neighborhood.
I love it. I love it. You're a perfect cheerleader. I'm going to kidnap you on the bus and take you with us. But what's going to be really important as we talk about the impact on the neighborhood, I'm excited that you're going to bring not just the St. Joe's experience, but the broader experience in the faith community as well. So this will be great. I'm so glad you're here, Phyllis. This is great.
Thank you. Thank you, Sister
And
Simone.
Sister Christine, I know you've got Christine, so up there. I don't know which way you prefer on this. So I know you're up to your ears in working here.
Well, there's a lot of things going on as always, and then as you said, we've been in the news. Rochester's been in the news. So anyway, I'm Christine Wagner, and I'm a sister of St. Joseph, and am the executive director of the neighborhood center, and one of 5 women that we call the founding mothers, who started this place over 26 years ago.
Wow.
So Simone, I'm really glad that to see you again, and that we had a chance to have another bus stop here. I would just say, in kicking off, that we very conscious of the fact that we're at the epicenter of healthcare crisis, economic crisis, and racial equity crisis, and it's merging right here at the center. And it certainly over the last couple of weeks the racial equity has come home very closely to us. So we got our hands in it all, and I think that's what we need to do. You can't just do one part without the other. So.
Oh, and I remember from our last visit, that's one of the joys of your work, is that you are able to do that integrative work. And
right.
So I'm going to be eager to hear more about it. And we didn't leave the male on the panel for last without a reason. So Joel, Elliot, do you want to introduce yourself and your role? And maybe you could take us on a bit of a tour of the center itself.
Thank you very much. Let me start by saying it is an honor to be here on the bus with you all today. My job is development, which is fundraising, and that's very important to the center's health, and also communications, which is storytelling, and as you can tell, that's very important as well. But I am very much used to being with powerful women. I have 3 sisters and a mother. So, my job, besides development and helping with volunteer coordination and helping with communication, I'm right down the hall from Sister Chris and right upstairs from Robin. So whatever they tell me to do, I better get right to it. So, and I wanted to take the viewers today, people who are with us, on a very quick tour. Since you can't be here, we can't offer you a snack. We can't have you sit down in our kitchen, but we can take you through a few of the spaces in the building. And for about the next minute and a half, I'd like to do that if we could get some support from our technical people behind the scenes. I hope everyone can see the entrance to St. Joseph's Neighborhood Center. This is it. It's 3 houses. Each house is 120 years old or so. They're all connected very creatively. So when you're inside, it seems like a health center that's comprehensive and integrated. If you go down to the basements, though, each one's separate. We couldn't dig tunnels, but upstairs, at least, it's 3 houses combined into one. Let's go inside and take a look. The first thing you would get to do pre-COVID-19 is go into the reception center. And although we don't usually have Sister Chris answering the phones, that would be dangerous. She is for this picture, and behind her is Emily, the associate that works with Robin in healthcare access, which is very important. As Robin said, that's our first stop, and that's where we find out about all the things that contribute to a person's health, including food sufficiency, including a safe place to live, including some domestic tranquility in their life. Those things don't always come easy, but we need to know about that to be able to center care on the patient. Let's go to the next slide. Now we're in one of the examining rooms, and you can see one of our clinicians, one of our care providers. He's only 3 years old, but he's there with his dad. And actually, he had a toy physician's kit at home. So when he came into the examining room, he reached for the stethoscope. And from what I understand, the neighborhood center folks sent him home with a real stethoscope. So when he became a nurse or a doctor or a clinician of another type, he'd already have his stethoscope with him. Okay, let's go to the next one. This is also in medical, and we have nurses and nurse practitioners and doctors. We have about 100 licensed providers, all volunteers. We have actually about 500 volunteers who help the center go, with only about 20 full-time and part-time staff members. Hopefully his blood pressure is not increased because he's on the tour with us. Dr. Mona Halim in our dentist's office. When we say integrated, mental health care, dentistry, primary care, and we have about 3,000 patients who receive care in all those areas. 1,200 of them are our patients. So when they come to their doctor or their nurse practitioner, they come to us. And they come to the same one each time, whether it's a volunteer or a staff member.
Joel,
and our dentist's office, look.
Joel, can I ask a question? You just
please,
said,
please do.
You said that you had 5,000 patients, but 1,200 were yours. I didn't quite understand.
Oh, sure. Thanks for asking. I say these things so quickly. In the course of a year, 2019 as an example, we had 3,000 patients and clients that we treated in about 9,000 visits.
Okay.
1,200 of them were our primary care patients. And other ones came in because they had a situation, a problem, they lost their insurance, they couldn't access a service. And so we helped them for 1 visit or 3 visits, and then they went on to their primary care physician. There are other subtleties too. Some people can get insurance, and Robin, I'm sure we'll talk more about that. But let's quickly go through.
Okay. That's great. Thank you.
Nope, great question. And I hate to get caught with the numbers too, because it's one patient at a time that's important. So the next slide, please. Now you're with one of our super users. She even has a super user shirt. And we have an electronic healthcare record system like most hospitals and doctors' offices do, but ours has the capability of combining dental and mental health and primary care and specialty care all in one record, because that's integrated healthcare. We also can have a diagnosis of food insufficiency, which makes a difference in a person's health, even if it's not something a doctor or a nurse practitioner would treat per se. Next slide. So this is in our conference room, and this is when we've received a donation. We don't spend money on toilet paper, paper towels, wipes cleaning, garbage bags, also coffee. We don't spend dollars on that because people can donate that, and we ask them to. We have a wish list. And so this is 3 of our volunteers organizing some of the donations. This was an especially good day. And again, what we try and do is put all our dollars into patient and client care, and then to ask for the community to support individuals, volunteers with their time, etc. Well, that's a walk through the center. You've seen a good portion of it. And so, Sister Simone, I'll throw it back to you. Oh, last slide. Thanks for reminding me. We did a quick survey of volunteers, patients, and staff, and we found that they hailed from 78 different countries around the world. So even though we're Rochester and we're in one little corner of New York, serving the city and the surrounding areas, we still are quite an international place. Hopefully as international as the sisters on the bus today.
That's great, Joe. That's really exciting. And so I remember vividly when we were there 4 years ago, but not everybody that's watching was with us, because that was one of the problems is we only had the people on the bus. Now we've got this Zoom world, and we're recording this also so that we can post it on our map of our virtual bus trip, so everybody can download it and watch it at another time. But I'm really curious about the evolution of care for you all in this experience of so many colliding crises. And I mean, the ones I'm aware of are the economics and the healthcare. And I'm wondering, I don't know where to start, so I'm going to just throw it out, and any of you hop in. Well, what's the experience in your community at this point, and how is St. Joe's responding to it? with COVID and economics and the the racism so evident in our society? How are you all seeing that?
Why don't I kick that off and then invite everybody else in? So in a general sense, it truly is an evolution, because what we try to do is not assume what people need, but to listen to people, about what their needs and desires are and what they need to thrive. In fact, we're just kicking off what we're calling an emergent strategy process, where we don't want to assume anything about the future because none of us know what is going to happen. So we're collecting some data, and we truly are trying to keep ourselves in an emergent and in the moment space so that we are as close as possible to meeting the needs as they come up. And that's kind of the way we've done this for like 25 years. So we've added healthcare, as people have had needs. We've added mental health pieces as people have needs. And then the economy, we bounce with the economy. Our patient count goes up and down depending on how the economy is and what the state of insurance is. And Robin and our staff handle a lot of that. I would just emphasize the racial equity piece. I think when you were here before, we had just started a community-wide racial structural racism initiative.
Right. Yeah.
That has advanced to, we got a brand spiffy new name. It's called REGI, which is Racial Equity and Justice Initiative. We're working with our second cohort of 20 agencies to work them through a long-term view of how do you advance racial equity. Certainly, the circumstances of Daniel Prude's death in Rochester in the last couple of weeks has heightened our awareness. We're getting, our phones are, hooked with other agencies and individuals who want to learn more and have jumped to a different understanding and have woken up in different ways than they had before. There's a quote, and I forgot who had it, but it says, "Once you wake up, can you wake up anymore?" And we keep saying, all of us keep waking up every day if we're paying attention. So at this point, we're glad that we're in the racial equity space. We're glad people are calling. We're figuring out how to respond. And I'll toss it off to Robin, because paying attention to the social determinants of health right from the get-go, and having that be an integral part of how we determine a healthcare plan with our patients is really important. So, Robin, I think you can add to that in depth.
And Robin, can I just ask you, we at Network are keenly aware of the social determinants of health, but could you just give a brief little summary so everybody gets what we're talking about? And I'm eager to hear your experience.
Okay. With our social determinants of health initiative, it was very important for us to, since we are integrated health center, to involve the different barriers that impact our clients, whether it's food scarcity, transportation issues, things like that. And those are the things that we relay that information to our medical providers, our nurses, our doctors, to allow them to have a better understanding of our clients as they treat them. You can't recommend for example, a high diet and fiber, for example, and the clients don't have access to purchase ingredients or foods that have high fiber. So those things are very real in our community, and we took the time to find out from our clients what these barriers to their health care were. The survey that we use here, our social determinants of health survey, it actually was compiled by our patients. We did a huge survey, and they told us what were the things that they were having problems with. And from that, we compiled our survey. So there's other ones out there, but we're using one that our patients told from what our patients told us that they need. Once we gather the information.
Wait, just a sec. Would you be willing to share that survey with us? Because I would love to post it so folks can see the concerns raised by your people. It would be really helpful. I'd also like to lobby Congress with it to show a bit of reality. Just saying. This isn't political. Just, education. Just education.
And so what we found it very useful. For example, last week I've worked with our You Are Well clinic. There's one night a week here at the center where the students are here from University of Rochester's Medical Center. And they come in with preceptors and our staff lead, and they see patients here. And so it's awesome. We work with quite a few students on various levels. I look at us as a educational institution also, because we're always training someone. I'm currently working with a social work student. So our involvement is, and on those evenings, we have social workers, we have pharmacy students, in addition to the medical school students from the University of Rochester Medical Center. And these students come from various universities: St. John Fisher, Nazareth, University of Rochester, and chime in if I left anyone out, Chris and Joe. But so we take a lot of time with the next generation to try to teach them healthcare, medicine, from doctors that are volunteering their time to teach them various things. So they actually get to lay hands on a patient. And usually that doesn't happen for a lot of medical school students until approximately their third year of med school. So they're receiving quite a bit of experience. They're partnering with us, and we really do enjoy working with our students. But going back to say, with the social worker will go in prior to the medical school students, and then come out, and in their huddle, they share the information, what barriers this client is experiencing. Does this client have a will to stop smoking? That was one last.
Wow.
So what are we going to do to assist them? We use the PHQ-9, some of the clients, and what that is, it tests to see if a person is depressed or having some mental health issues. How can we address that? So we take all of that information, we kind of do a huddle on the client and approach the client and a partnership to see what's the best way to meet that client's need and provide the health care that's needed. And
that's fabulous.
It is fabulous. I'm very happy that we've brought the access department more in the fold of the medical department, and we're working as a team. Everything is integrated. Dental, we work with dental. We have patient care council meetings where we actually get together and we talk about our clients who are experiencing issues and what can we do to better assist them. I will admit, St. Joe's Neighborhood Center is not always the best solution for clients. And if that's the case, we want to find the best solution. So we will try to assist with helping get insurance. We have navigators that we work closely with. And one of the limitations that we have, because one of the limitations that we do have, we don't have a lot of specialties. We depend on our volunteers. So we need volunteers to agree to come after they've already done an 8-hour shift at their normal job to give us an hour or two in the evenings or on their free time to provide different specialties in addition to primary care. So it's a very unique model.
Yeah.
Awesome. I think we pay very close attention. It's hard for us to get our clients out of here when we do get insurance for them, believe that or not. It's very hard, and I get it. I wished I had the opportunity to sit and have longer conversations. Our providers, they really do care about the patients, and they have time to take and care. They're not being ran by time limits, insurance, things like that. We just don't, that's not one of our barriers.
Amen. Oh, as you were talking, Robin, about having this team huddle, I thought, what, I mean, how that would lift someone's dignity to know that this group of people is working together for me. I mean, that just seems like such a enriching view of how you matter, of that broad way of healthcare. How wonderful.
I'm just thinking some of the people in the audience might be wondering how we do this. And the focus of our work is the uninsured in the greater Rochester community. Though we have, Rochester is situated on the southern border of Lake Ontario. Erie is 2 hours to our west, and Syracuse is an hour and a half to our east, and our border with Pennsylvania is another 2 hours away. We have people from every point in the state that make their way to us because they can't find the services that that they want or that they need. So we say Rochester, but the only requirement for being here is lack of access to the care you need, and just kind of getting here. But so people wonder, how do you do it? Well, we made the decision very early on, 25, 26 years ago, that we were going to be what we call fiercely independent. And what that means is that I'll let Joel talk about our ridiculous financing model. But the fierce independence is we don't deal with any insurances because we're mostly working with the uninsured, but we wouldn't anyway because the insurances come with red tape. We do not depend on any state or federal funding because that is expensive to apply for and manage, and it comes with its own set of red tape. So, we are supported by the community. We're actually a non-licensed facility in the state of New York. New York State is fine with that. Every volunteer that comes in here, a physician, is treated as if this is his or her private doctor's office. So that's how we can be unlicensed. What that allows us to do is to spend as much time with the patient as the provider wants to. It lets us be creative in our solutions, in creating a pathway to health that the medical model as it's running doesn't give anybody the time. No physician, no patient has the time to actually do what we do. But we believe in the model of if the patient is here, you spend as much time as you need to. And we have a lot of partners in the Rochester community. One of our imaging centers does all of our simple X-rays for free for all of our patients, and they give us payment plans for more extensive imaging. We have a lab that does all of our lab work at ridiculously low prices, which the working poor can afford to do. So our fierce independent.
Oh, Chris, so the cost then of like outside lab work or that kind of thing, the patient picks up, or you find ways of making
if the patient can. If they can't, we have a patient care fund that we can dip into. But most folks want to contribute to their own care, and it's a really good model. They understand for us to keep our lights on, we've got to be able to do this. And so you have a lot of partners. They're wonderful partners, but there's not a signed piece of paper between us with anybody. So we're not, holding ourselves or them to anything. It's just let us be creative, let us do the best work we can. And our partners are loving it. And all of our other sister agencies are saying to us, don't change because you're the only place we can refer people to. So,
well, okay, Ms. Jackson.
Just a moment. I am just itching to jump in here because let me say that first, I just want to throw this in this little aside. He said the 3 buildings, and they're 120 years old, and I think that is just so appropriate to look at that you have St. Joe's in these 3 buildings. So 120 years old. You're speaking to, continuity and sustainability, and you're speaking to history. And so I think it's just so appropriate because for IFMC, our theme is wholeness of mind, body, and spirit. And so here you have this model in St. Joe's. This is so important. St. Joe's is so important for this community and in our area because it says there can be health care for all. This is the model. We've heard so much rhetoric. We've heard so much talk about how it can't be, why it can't work. It's working. We have a working model. And so for this organization to be here, for St. Joe's, is just so important for this community. When we're talking about equity, you're talking about social determinants. And this is a model addresses all of that. How can you have equity, racial equity, and not have equity in health? How can you have spiritual equity? How can you have economic equity when you're not addressing all of the issues that make the whole person? This is a whole person organization. They're not fragmenting. They're not compartmentalizing. They're looking at the whole person, mind, body, and spirit. And a good example is when I was at nursing school 100 years ago, 120. Okay, years ago, we nurses made the nursing diagnosis when the patient came in. The doctor made the medical diagnosis. Nurses made nursing diagnoses. And so we were allowed to put things on our diagnosis and care plans that would impact the patients. That wasn't done at, then, doctors made diagnoses, but we could put on our nursing diagnosis thing as patient is malnourished. But it was not a part of the medical record. It wasn't something that became engaged. It wasn't integrated so much in the nursing key, in the physical medical care. But to see integration is what we were looking for in nursing way back then. And I got to shout out to nurses because in nurse practice, this has always been how we looked at patients.
Yeah.
But to be able to say malnourished, food insecurity, and that become part of the diagnosis, which helps determine whatever else we need to do. If a person is hungry, if a person is malnourished, you're not going to be able to treat all the physical conditions well, and they're mentally not going to be able to function well. And so to be able to integrate that into the care plan, the medical care plan, and the mental health care plan, the dental care plan, is just huge. And so to be able to bring St. Joe's to the table to example this and to model this is what we're looking for when we're talking about equity, and to be able to say that they're engaged in racial equity, but you're a healthcare agency. Oh, please excuse me. How can you have one without the other? Because they all impact. And so this is just huge. She said 78 countries. Do you know how many of our immigrant people population would be in dire straits? We were not able to say, we will take you. We can send you there. You can go there. Because so many of our other agencies have so many stipulations for treating these people, for treating people that are uninsured. So I just want to say that this is just a local organization, it seems, but really it has a real global impact and can have a global impact because of the model. And it works. It works, folks.
Okay.
To say it works. And
well, Lord knows
that it
will
works.
work. That's for sure.
So I just had to say that it's important for this community and other communities to look at this model. And to see that we can have healthcare for all.
Right. Well, but okay, I think it's a model. We want to get to Joel to find out what abracadabra magic he does in the development office that makes all this, help make this work. But I also want to laud staff, you all, because it does take that commitment to fierce independence that you talked about, Chris. And fierce independence has challenging consequences sometimes. I started a law center in Oakland, California, sort of on that same model, because I didn't want to take grant money that then could be ripped away and our people suffer because of it. So we charged everybody on a sliding scale, and we did that model. And I did it for, I don't know, 18 years or so. And then it continued after me. But it really does take people power and a vision that can keep that going. So I want to laud you all for the vision. But now I want to turn to Joel and say, okay, now that we've got the vision out of the way, how do you do this?
Well, first of all, we have supporters like Common Ground Health that study the situation and look at healthcare in Rochester, any city really, any rural area too, and go, we need an option that includes comprehensive integrated care. So we start with having all these great partners, all the universities that loan us students so that we can focus on our way of providing patient-centered care and hopefully send them out into the world. And the last thing before I get to the nuts and bolts is folks like Congresswoman Louise Slaughter of blessed memory, and Joe Morelli, who has stepped into her very large shoes. They understand what we're doing, but if they have a constituent who's falling through the cracks, they call us and they say, Bill has to come over and talk to Robin and talk to her staff to see how we can meet healthcare needs, because insurance, the emergency departments, all the other ways of providing healthcare aren't working for everyone. And in New York, we were doing pretty well. It was almost 96% were covered by some kind of insurance. But if the insurance doesn't pay for what you need, that really doesn't help. If you have a high deductible and you don't have $5,000 lying around, that doesn't help. So we take that story and we go to the community every year, and about 90% of our operating funds come from grants from small foundations or health legacy foundations, but mostly from individual donors. And I did a quick look over the last 3 years. We've had 2,000 people. Some of them just send us $10 at Christmas time. Some of us send us $100,000 to start out the year. And that's the whole range. Usually a large funder will say, and you know this, Sister Simone, I'm not going to pay for operating or for overhead. I'm not going to do it. I want my name on a bill.
Program. I want to.
Right.
Yeah.
For us, we open the door saying we're charging the patients the $10 or $20 they can afford. So if you think what we're doing is important, we'd ask you to support it with an investment. And that's the whole development story. So we get about 80% from individuals, 10% from the patients themselves, and 10% from foundations.
Wow, that's fabulous.
It's terrifying.
No, I totally feel your pain. I get it. It's
scary at the end of the year. Yeah.
Yeah.
I think.
And then it's God and Holy Spirit time.
Yeah, there you go. Yeah. I think one of our guiding principles or mantras, or whatever you want to call it, is that we have to follow simultaneously two tracks. That we have to guarantee that the day-to-day care for each patient and client is of the it's a holistic nature and is of the utmost quality, and we monitor that. And I'm also very cognizant of the fact that all of our providers who come in contact with patients and clients absorb the stories of each one of those patients and clients that come in. And I'll face it, people don't come here unless they're in crisis. So we're in crisis listening mode all the time. So our caregivers go away with these stories or absorb these stories. But the other track is that we try to look at all of those stories in the aggregate also, because the aggregate of those stories indicate the patterns, tracks, barriers, gaps, everything in the system that's not working. And we believe it's our responsibility to take all of those things from the aggregate stories, what we learn, to system tables and to change tables. And that's where I spend a lot of my time. So, if you only pay attention to the individual, that's all you do. And I think you're not bearing the other half of our responsibility, which is to change the system. If you're only trying to change the system and you don't have any contact with individuals who are in need, then you're talking about.
Amen.
So both of those things have to happen. So we're trying to do the day-to-day and have the day-to-day inform the system change that we'll strive for. And that's just so important, I think, for anybody who does this kind of work.
Well, absolutely, Chris. And the founders of our community, I'm a sister of social service, and the founders of our community said, we're all social workers. So she said there was this pyramid. There's direct service, there's group work, there's movement work, and then at the top of the pyramid was legislation. It's probably because she was in Parliament, she thought it was at the top. But what she said was that each level was only as good as its relationship with the other levels. Because if you get disconnected from any one of those levels, we lose perspective. So
Yes.
it's absolutely what you're saying. Now I'm going to shift the conversation just a teeny bit because we only have like 20 minutes left, or 15 minutes for this part. And then I know there's a video that we want to end with at the end. But can
I just add, Sister Simone, that
Sure.
that one of the things at Common Ground is that we understand that research and analytics are necessary, and it's at the heart of healthcare transformation. And so, this may sound like St. Joe's, all this good stuff. It's warm, fuzzy, it's feeling, you know what I mean? But the reality is, it's not just warm. It is all of that, but it's also data driven. All right, there are metrics. They're measuring. This is not fly by the seat of our pants and hope that everything we're going to land well. There are metrics. There's data being used. They're gathering to have a survey and say, what is to your patients? What do you need? That's data that we can utilize and we can bring to other tables and say, this is data. We're not imagining this. We're not getting secret messages in the night, though we may do that from the Holy Spirit. We still have data, and data is important not only to those that want to give, but to those that are working within the systems in order to measure what we're doing, does it work, and how it works.
Amen.
So data
Amen.
and analytics is key to the work that they're doing there. And so that is a part of that model, as you said. And it impacts how we go. When we go to the legislatures from Common Ground, we know we have the metrics, we have the research, we have the data with us to say, yes, this works over here and we need to support this. And this is how that fits in with the region, not just for St. Joe's neighborhood and their street, but for Rochester and the state
And the
all together. Absolutely.
Yeah. Makes good sense. Okay, I want to shift it just a little bit, but it's going to this metrics point because that is critical for data-driven decision making. But Robin, maybe starting with you, I'm really curious about the COVID impact because I have to imagine that the pandemic has made this even tougher for you all. How has that impacted your patients, your clients, your community? What do you see?
Oh, it was a huge impact. Considering the one-on-one contact that we were used to having, we had to change everything and start doing quite a bit of things over the phone. And the way that I help a lot of my clients is hands-on. We're right in person. We're usually completing applications together or whatever type of paperwork. So we used a lot of mail, back and forth through the mail. And it was great that New York State did loosen some restrictions on supporting documents that were needed. Usually we have to provide like a driver's license or a lease agreement, something like that. So they did lessen those requirements. So that did make our job a lot easier in helping our clients get the food stamps that they needed. Unemployment was the hardest of my task going through New York State and unemployment, helping my clients. There was one client, we finally figured it out towards the end of May. She had $8,000 in her account and she could not access any of that money. She has a learning disability, often are helping people just figure out things, read their mail, help them with their mail. What's the next step you have to take to follow in order to get some type of assistance? So that was a major challenge. And what I'm seeing now is just a lot more desperation, more people in need of assistance just to get by. One of the things that we also do here is help with food cards and Walmart cards was a big help to people who needed to buy the hand sanitizer, the bleaches, because what we usually provide it for is food, generally food. But then I was like, there's a big population that's at a disadvantage that can't get some of the needs that they really need. So we received a couple of great grants. Chris kind of put the call out, and we received some funds where we were able to get cards that now allow them to get additional things besides food, because there was a population out there they just didn't have it. So a lot of times we hold people over until the next payday.
Wow.
We're lucky that we didn't close a day. We were able to shift our mental health services completely to either Zoom or a platform like Doxy or over the phone. So we didn't skip a beat on mental health and psychiatry. We initially, when COVID hit, we made a list of all of our, at that point, 900 enrolled people we had seen in the last 6 months. It was 900. And I had teams of people who called every one of those patients to ask them how they were, what they needed, if they needed medications, and it helped us clean up our list, but it also put us in connection with our patients and clients. Then we did a second round of that, and of course, then it was a month, 6 weeks into the pandemic, and people were running out of their medications, and so we were able to do a lot more medication filling. We set up some Zoom or telehealth, appointments. And then we've gradually opened up and figured out the protocol for having on-site visits. And we're, knock on wood, we have had no staff positive results.
Wow.
One or two people on the phone that we've been able to work through their COVID contact. But we were really, really worried about our folks with diabetes and high blood pressure and cardiac issues, that you got to have hands-on with those patients. It's not enough to talk on the phone. So thank God we never had to close one day, and we've been safe, and our patients and clients have been safe through that as well. And again, the staff has been absolutely stellar. There was never any less than 9 to 13 staff and volunteers in the building since the beginning of this, just reaching out to our patients and clients and doing the best we could. So it was phenomenal. It was phenomenal.
Sister Simone, I'll add one more story. In that phone calling process, we connected with one of our patients, and seemed like our clinical coordinator, in conversation with him, was concerned that he was having a series of small strokes, but he was afraid to go to the emergency department. It was early on, so you can imagine. So she encouraged him. She encouraged him again the next day, and then she said, listen, go to the emergency department, or I'm going to drive over there and pick you up and take you myself. And so that encouragement was what he needed. He called back the next week, thanking our clinical coordinator, Sue, for saving his life. It was not a life-ending stroke, but he was having a series of small strokes. And so he really needed the attention of the hospital care. So those are the kinds of things we could do on the telephone and with telemedicine, just by having relationships. And so it was more than putting off a regular visit, which of course we had to do as we were getting resituated, but it really was also continuing those connections with our patients.
Wow. And putting the priority on connection and on health for the whole person, I can just see how that plays out. And hearing, Robin, about your work with your folks to get them unemployment insurance. I mean, that's got to be one of the most challenging, antiquated, blah, blah, all the other challenging systems to deal with. And there was so much effort at the federal level to try to get people emergency help, and then to hear how it got stretched out. Oh, how hard. Well, one other question I'm curious about. Chris, you were talking about the the work on structural racism and engaging the issues organizationally. How do you think that's impacted your staff for St. Joe's? I'm sure you must do work together about it, and
we do some. There's always, of course, much more to do.
We need to rewrite the world. That's it. We need to rewrite the world.
That's right. Just rewrite the manual for the world. But what we've been able to do is just heightened awareness here at the center for, like our hiring practices. What is the what's the diversity level of our, of our staff or of our volunteers? And, in many of those things, we come up short. And so, you don't wallow in that. You go, well, why are we coming up short, and what do we do about it? And that's what many of the organizations that we've been working with have found too. I know that one of the organizations has completely changed their recruitment and hiring practices. They, for instance, when they get a resume in for a job now, they eliminate the names on that, so that you're just looking at the resume. You're not, there's no bias about what's name or that.
Right.
So this is an organization of several hundred people, and they've completely changed things. We have what's called a change team to specifically look at and initiate efforts around racial equity. And every one of the now 40 groups that we've worked with, we ask them to have a change team that's very active. And it's also important for us, the invitation to join our racial equity work goes to the CEO or the executive director of the group, because we know that if they are not on board and involved, it's not going to go anywhere in the organization, because the inequities and the power structures within an organization are impacting any racial equity work, that you do. It's interesting, in the current cohort, the city of Rochester has got 17 of its departments involved with change teams. Now, I think it's kind of ironic that it's, the police department is one of those departments, and they're having a whole lot of trouble. So we'll go back to them and go, okay, well, what's happening here?
Yeah.
So, but we're in the middle of it. But, and we really believe it goes down to the personal transformation level, and then to the interpersonal, then to the institutional, and then to the structural. So we're really taking a long-term view on how racial equity will come about in our community, and it starts in our own internal biases and identifying those, and then goes out from that. So we've taken a long-term view on this, and we're starting with ourselves. And we, as I said, I know we have come up short, and we're trying to do better. So it's such important work. It's such important work, and it so goes along with healthcare.
It's at the heart of healthcare in so many ways.
That's right.
Yeah. But what I think this does is lifts up this. I mean, for me, it highlights the holistic approach. That the issue of racism is at the heart of healthcare, is at the heart of the failing of our nation, is what we then need to address and engage. Absolutely. Thank you so much for that. Now, I understand Joel's got the Good Development Office here, has collected a few things. Do you want to talk about this little video that we're going to see almost? And then what I'm going to ask, so that you're all prepared, is I'm going to ask you, after you see the video, we see the video, what is the best thing about being connected in some way or another with St. Joe's Center, okay? And I'm going to end with you, Chris. So probably start with you, just so you're prepared, okay? So, Joel, do you have...
You're going to be seeing a little video clip, and it was part of a little bit longer video that was done for our 25th anniversary a couple years ago. The videographer who volunteered her time, a wonderful woman named Trish, asked folks one word or one short phrase to describe the neighborhood center. The first 8 seconds is silent, so you can think of your word, and then you'll hear about 20 seconds of things. listen for the person. She's not a member of a religious order or a spiritual community, but she uses the word charism. Listen for that in the clip. All right, we can run the clip now.
Sanctuary.
Refreshing.
Lifesavers.
Loving kindness.
Welcoming.
It's colorful.
Family.
Amazing.
Collaborative.
Hope.
Friendly. Incredible.
Magical.
Compassionate.
Joyful. Charism.
Neighborly.
Genuine.
Vital.
Blessing.
Family.
Gratitude.
Charity.
Loving relationships.
God sent. Fantastic.
Non-judgmental.
Intentional community.
Loving.
Wow. Oh, that gave me goosebumps. Thank you. How perfect.
It's a great piece.
Oh, tears in my eyes, goosebumps on my body. Love it. Okay, let's see. Okay, so we're going to end with just hearing a little bit about what's the treasure for you in this relationship. And Miss Jackson, do you want to lead us off?
I guess I would say life-giving. For me, St. Joe's exemplifies what the Apostle Paul wrote in Corinthians, that we are many members in one body, and that when one part hurts, the other hurts, and that we're all connected. And that's what it is for me. And that's what touches my heart, and I think so many others. Is that, yes, there are many members, many colors, many, all of that, but it doesn't matter because we're still yet one body. And I think they so exemplify that in the heart of what we believe is the gospel.
That's one of my favorite scripture passages ever. So, whoa, I really resonate. Thank you. Robin, what would you say?
I would say just the ability to help the community, whatever that may mean. If we don't have the answer, we go find someone who does. It may go as high as Chris taking it to one of our elected officials on the state or national level, even. That has been done. But we don't stop until we solve the problem and we're committed to the problem. And the problem could be big, it could be small, but we're on it.
Whoa. What a satisfaction to be engaged in people's lives that way. Together. That's beautiful. Thanks, Robin. And Joel, in your corner of this amazing operation, what would you say?
I feel so excited to come to work every day. And for me, it is about the healthcare and about envisioning a way of providing health care that is probably the right way, the way that we all ought to think about it. But more than that, it's the people, the small staff that I've gotten to know here, and all of the volunteers with this amazing motivation to come in and do good for folks, one patient at a time.
Oh, I love it. And Chris, why don't you close us out and then we'll just end saying goodbye.
All right. Thank you. I would say it's the potential of relationships. Relationships are at the heart of everything that we do. But we often say, what do we need to do next? There's always more. And sometimes we've had the vision of where is the next edge? And we got to find that edge and we got to jump off, even though we don't know how far we're jumping. We have only 2 rules here at the Neighborhood Center, Simone. The first rule is if you think of it, you do it. And I just say to people, if you have a thought and you don't express it, you might as well not have had the thought. Let us take your idea, massage it, and see what we can do with it. And maybe it's an idea whose time has not come yet, but we will move, and that's how we have added new programs. The other rule, just so you know, is if you don't know what to do, vacuum. He's just creative and clean, and that's all we need. So.
Oh, amen. And as you were saying that about going to the edge, we did a noontime prayer gathering for some of our sisters that are on our virtual bus. And the scripture that came to me in that course was remember the apostles out on the sea, and Jesus walks across the stormy sea to them. And Peter says, "Is that you?" And Jesus, "Is it really you?" And Jesus says, "Come." And he leaps out of the boat, and he's fine, leaping off the edge. It's great. And then loses a little faith, loses a little. So, but is saved in the process. So I want to thank you all for the amazing work that you're doing in Rochester and the witness that you are to all of us who've been able to talk to you, with you today, to listen to this. But also, I really want to thank you on behalf of your patients for the fact that you're showing a holistic community in a time where our nation is so torn apart. And I think that the health of our nation, you minister to the health of our nation. And so on behalf of Network, thank you for sharing this time. Thank you for being part of our Nuns on the Bus. And just know that we'll carry you with us as we're on this virtual highway. Thank you so much.
Thank you, Simone, for the opportunity. It's been great.
Fabulous. Thank you.